Hi, I'm Elijah. I'm going to be your nursing student today. Can I get your name and date of birth?
Angeles Clark, 8/20/99.
All right, that sounds good. I'm going to wash my hands. I'm going to close the curtains to give you privacy. And I'm going to check your wristband and my chart to make sure that the information you've given me is correct. All right, that all looks good. I'm going to do a head-to-toe assessment on you today. Does that sound okay?
Yeah.
Is it okay if I touch you?
Yeah.
All right, sounds good. First, I'm going to take your temperature orally, 98.6. That looks good to me. I'm going to get your radial pulses. They're both equal, strong, and at 70 beats per minute. That's good. I'm going to look at your respirations. They're 20 respirations per minute, and they look unlabored. That sounds good. I'm going to get your blood pressure using the two-step method. It's at 120/80. That's perfect. And I'm going to get your oxygen. It's at 99%. Perfect. Are you having any pain?
No.
All right, that sounds good. Can you tell me where you are?
I'm in St. Paul, Minnesota.
Can you tell me why you're here?
I'm here for a head-to-toe assessment.
Can you tell me what time of day it is?
It's noon.
And can you tell me who you are?
I'm Angeles Clark.
All right. Patient is at alert and oriented ×4. All right. Can you just look forward for me? All right. I check the pupils. They're round, they're equal, and they're about 5. So that's all good. Now look forward. I'm going to shine this light in your eye. All right. They react to light. Perfect. Now can you look at the pen? And now look at the wall behind it. Back at the pen. And now the wall behind it. That's good. They accommodate. And now just follow my pen with your eyes. All right, that's perfect. And now I'm going to put my pen behind your head and just tell me when it comes into your line of sight.
I see it.
All right.
I see it.
Perfect. Now, could you sit up for me? Okay. I'm going to take note of her hair. It looks clean and washed. I'm going to take note of her face. There are no signs of stress. I'm going to take note of her gait and posture. It looks good. I'm going to take note of the way she talks. Through it, I see no problems or no signs of mental problems. So that all looks good. I take note of her cultural preferences. Do you have any cultural preferences? No. All right, sounds good. So now I'm going to do her skin assessment. I look at her skin, and looking at it, I see no signs of cyanosis or anything, so that's good. I check the temperature. It's nice and warm. That's good. I check the moisture. It's not too dry and not too moist. That's good. I check for any signs of. I check for the skin quality, and that all looks good. I check signs of edema or breakdown. And there don't seem to be any signs of edema or breakdown, so that all looks good. Now I'm going to go ahead and take the temporal pulses. So I'm going to take these. Those are equal and strong. I take the carotid on one side, and then the other. That's equal and strong. I'm going to take the brachial pulses, equal and strong, and now the radial pulses. Equal and strong. And now, could you open your mouth for me? I check the mucous membrane. That looks good. And then into her nose, mucous membrane. That one looks good as well. All right. Could you push up on my hands for me? That's good. And now push down on them. Perfect. Now could you squeeze 2 of my fingers? Wow, you're really strong. That's perfect. All right. Now give me 1 finger, please. I'm just going to press down on this for 3 seconds and then release, and the capillary refill is within. It's under 4 seconds, so that's perfect. All right, now I'm going to go on and do the lung sounds. Or wait, could you close your eyes, please? I'm going to run my finger along her forearm, and then I'm going to ask her, did you feel anything?
Yeah, got fingers along my forearm.
All right, which side?
On the left side.
All right, how about now?
Fingers along my forearm on my right side.
Perfect. Okay, now I'm going to listen for lung sounds. Okay, I'm going to listen to bronchial, bronchial, and those are loud and clear. Bronchiovesicular, 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 vesicular, 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 and vesicular. All right, those all sounded good. And now I'm going to listen to your back. Okay. Bronchial, bronchial, bronchiovesicular, 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 vesicular, 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 and vesicular. All right, those sound good. Now I'm going to listen to your aortic pulse. That's good. And your pulmonic pulse. That's good. Now tricuspid. That's good. And atrial. That's good. Now epigastric sounds. Those sound good as well. Okay, now could you lay back down for me? Are you having any bowel troubles?
No.
All right, that sounds good. First, I'm going to examine her. I'm just going to look at her abdomen, and that looks good to me. Now I'm going to listen to the 4 quadrants of her abdomen around her belly button, and I'm going to listen to each quadrant for 1 minute. And I'm just going to be listening for bowel sounds happening around every 5 to 10 seconds. And that all sounds good. Are you having any urinary problems?
No.
Are you having any sexual problems?
No.
All right, that sounds good. Now I'm just going to palpate her abdomen, feeling for any masses. And I don't feel any, so that's good. And now I'm going to palpate her groin area, and that feels good as well. I'm going to take her femoral pulses. Those are equal and strong. And then under her knee, I'm going to take her popliteal pulses. Those feel equal and strong as well. And then her posterior tibial pulses. And those are equal and strong. Okay, can you push up on my hands for me? All right, that's nice and strong. And now down on my hands. That's good. And now close your eyes. Can you tell me what you feel?
Your fingertips on my upper calf on the right side.
All right, and now?
Your fingertips on my upper calf on the left side.
Okay, and now can you stand up for me? All right, put your hands up in front of you and close your eyes. All right, I'm going to let her stand like this for 30 seconds, and I'm just going to take note of any swaying or gait problems, and I see none. That's perfect. You can put them back down and open your eyes. Now do what I do. All right, her coordination is good. And now for the last bit, I'm just going to have her walk to the end of the hall and walk back for me. I'm taking note of any signs of gait problems and watching how she walks. All right, that looks perfect. Thank you.